just can't figure out what's wrong with your granddaughter.
What do you mean? You don't know? I mean, I thought you were some kind of fancy doctor or something. We need one of those nurse practitioners. Figure this out.
Somebody say nurse practitioner?
Yes.
Hello. My name is Lorna Sullivan. I'm a nurse practitioner student at Auburn, and I'm here to help. Doc, what's the problem?
Really? I don't know how you think you're going to figure this out when I can't figure it out. But the patient was treated for a UTI 4 days ago with Bactrim. And now she's presenting with flu-like symptoms and this painful rash all over.
Doc, I think this patient has Stevens-Johnson syndrome.
Steven, what? Syndrome?
I'll explain everything. Doctor, Bactrim is a sulfonamide drug. Other drugs in the sulfonamide class are sulfonazine, sulfamethoxazole, Bactrim, which is sulfamethoxazole, and trimethoprim, sulfamethylpyrazine, sulfadoxine, and there are also some special purpose drugs that treat burn victims, such as mafenide, silver sulfadiazine, and sulfasalazine. Actions of sulfonamide drugs: they inhibit gram-positive and gram-negative bacteria. There are many susceptible organisms, including protozoa. Therapeutic effects are: they are antibacterial and antiprotozoal. They treat and or prevent infection. Pharmacodynamics: sulfonamide antibiotics work by disrupting the production of dihydrofolic acid, which is a form of folic acid that bacteria and human cells use for producing proteins. Microorganisms that use exogenous folic acid or do not synthesize folic acid are not susceptible to sulfonamides. Clinical use as monotherapy is uncommon, and sulfonamides and trimethoprim both have distinctive pharmacodynamic properties that are enhanced when combined. Oral sulfonamides are absorbed readily from the GI tract. They are distributed widely throughout the body and found in all tissues. They are bound to plasma proteins in varying degrees. Metabolisms of sulfonamides occurs in the liver, and they are mainly excreted in the urine, but small amounts are excreted in the feces, bile, breast milk, and other secretions. Precautions include: they should be used cautiously in patients with blood dyscrasia, glucose 6-phosphate dehydrogenase or G6PD deficiency, renal impairment, and folate deficiency. It is pregnancy category C and safe to use while breastfeeding, and they are contraindicated in infants less than 2 months. The most common adverse reaction is GI upset, photosensitivity, and rashes, and generalized skin eruptions are also common. Another side effect is Stevens-Johnson syndrome, which is a medical emergency. It is a rare, serious disorder of the skin and mucous membranes. It has flu-like symptoms appear first, and then a painful rash that spreads, and then blisters follow.
Oh, baby.
Other adverse reactions include cholestatic jaundice, hepatitis, hepatocrosis occur as a result of direct toxicity or hypersensitivity reaction. Sulfonamides interact with several commonly used drugs, including salicylates, warfarin, and hydantoins. Excuse me. Sulfonamides are indicated for UTIs. Bactrim is the most common drug to treat UTI when no complicating factors are present. Upper respiratory infections, MRSA, exacerbation of chronic bronchitis. Sulfasalazine is used to treat ulcerative colitis and rheumatoid arthritis. Mafenide and silidine are used to prevent infection in patients with burns. Rational drug selection is that antibiotics therapy is indicated only when the benefits outweigh the cost and the risk of treatment. If antibiotics are deemed necessary, Empirical selection or definitive culture-derived selection are both appropriate strategies. Sulfonamides are useful low-cost agents for proven susceptible urinary tract infections, and Bactrim plays a key role as an affordable and effective therapy to treat MRSA. For most infections treated in outpatient settings, it is sufficient to monitor clinical response alone. Culture of the urine to follow up a UTI will verify eradication of the infection. If a patient is on a long-term sulfonamide therapy, periodic assessment of a CVC, hepatic function, and renal function should be conducted. Patient education includes to complete the entire course of antibiotics, take as prescribed on a regular schedule, abstain from sharing medications with others, take with a full glass of water, avoid photosensitivity by wearing protective clothing and sunscreen. If a rash develops, discontinue the drug and contact your healthcare provider. Notify provider of blood in the urine. Notify provider of a sore throat, fever, chills, pale skin, unusual bleeding, or bruising. And that explains it, doctor.
Thank you so much, Auburn University nurse practitioner student. You saved my life. You're welcome.
Thank you. Oh my God. Thank you, Lord Jesus.
I have great
I don't
instructors
do
that
this
teach
anymore.
me.